At a press conference, Dr. Tedros Adhanom Ghebreyesus, the WHO Director General, pointed out that in just 2 weeks, COVID-19 cases outside China had increased by 13 times, and the number of countries reporting cases had tripled. He stressed that further rises in cases were likely and expressed grave concern about both the rapid spread and lack of action. He called for countries to act decisively, saying, "We must step up our efforts and become more aggressive." Among the WHO's current recommendations, people with mild respiratory symptoms should be encouraged to isolate themselves, and social distancing is emphasized, and these recommendations apply even to countries with no reported cases. A study in JAMA indicates that SARS-CoV-2, the pathogen behind COVID-19, was predominantly found in respiratory samples from Chinese patients, though live virus was also detected in fecal samples. The researchers propose that the virus's potential to spread via both respiratory and other bodily pathways may account for its rapid global spread. Risk factors for severe illness remain uncertain, although older age and comorbidity have emerged as likely important factors. The safety of supportive care strategies such as oxygen by high-flow nasal cannula and non-invasive ventilation are unclear, and the risk of mortality, even among critically ill patients, is uncertain. There are no proven effective specific treatment strategies, and the risk-benefit ratio for commonly used treatments such as corticosteroids is unclear. In December 2019, a cluster of severe pneumonia cases of unknown cause was reported in Wuhan, Hubei Province, China. The initial cluster was epidemiologically linked to a seafood wholesale market in Wuhan, although many of the initial 41 cases were later reported to have no known exposure to the market. A novel strain of coronavirus belonging to the same family of viruses that cause severe acute respiratory syndrome SARS, and Middle East respiratory syndrome MERS, as well as the 4 human coronaviruses associated with the common cold, was subsequently isolated from lower respiratory tract samples of 4 cases on the 7th of January, 2020. On the 30th of January, 2020, the WHO declared that the SARS-CoV-2 outbreak constituted a public health emergency of international concern, and more than 80,000 confirmed cases had been reported worldwide as of the 28th of February, 2020. January 2020, the U.S. Centers for Disease Control and Prevention announced that all citizens returning from Hubei Province, China, would be subject to mandatory quarantine for up to 14 days. But from China, COVID-19 arrived to many other countries. The incubation period can inform several important public health activities for infectious diseases, including active monitoring, surveillance, control, and modeling. Active monitoring requires potentially exposed persons to contact local health authorities to report their health status every day. Understanding the length of active monitoring needed to limit the risk for missing infections is necessary for health departments to effectively use resources. In conclusion, in a very short period, healthcare systems and society have been severely challenged by yet another emerging virus. Preventing transmission and slowing the rate of new infections are the primary goals. However, the concern of COVID-19 causing critical illness and death is at the core of public anxiety.